Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. Welcome to my presentation. My name is Puji Nabila and I'm the nursing student of Bhakti Kencana University, and I'm so glad to be here today and to talk to you about 5 skills nurses must have. My topic is divided into 5 parts. The first is about able to provide nursing care. The second is about able to be an educator and counselor for patients. The third is about carrying out the assigned task. The fourth is about being able to serve in limited circumstances. The fifth is about providing first aid in emergency condition. I will be glad to answer any question that you may have at the end. In addition to doctors, other medical personnel that you will often encounter when visiting health facilities such as health center or hospital are nurses. In addition to playing an important role in treating patients, sometimes doctors will also have difficulty handling patients if they are not assisted by nurse. The nurse, our task is to provide nursing service to the patient, families, and the community, and is responsible for improving health service and preventing disease. To be able to carry out this task, nurses must have several skills, including the first is about able to provide nursing care. Nursing care is a series of interaction between nurses and patients and their environment in order to meet patient needs. These activities are the ones you see or experience the most. Some of the things that are included are nursing care, for example, are making the bed, measuring body temperature, bathing the patient, draw blood for investigation, and much more. Well, this leads me to my next point, which is able to be an extension and counselor for patients. In addition to performing medical actions, nurses must also be good at communicating with patients. Nurses are required to be able to provide counseling to patients about their health condition, disease prevention, and other health improvement efforts. In addition, together with doctors, nurses will also be able to involve in counseling patients and their families to determine patient treatment. Right? Let's move on to the next point, that is carry out the task assigned. In practice, in the field, doctors often will find it difficult to carry out their duties due to the large number of patients or having to treat emergency patients. In this condition, the doctor will delegate the task to the nurse. In addition to delegated tasks, there is also a so-called mandate task, where doctors continue to supervise the tasks that are their responsibility, but nurses are the ones who do it. I'd now like to look at consider is able to serve in limited circumstances. Every nurse must be ready to be placed in a very limited area where there are no other health facilities, limited medicine and facilities, or even access to distant referral health facilities. In this condition, nurses must still be able to carry out treatment for common disease in accordance with available facilities. If needed, the nurse will also usually provide a referral to patient or the doctor's instruction. Let's move on to the next point, which is provide first aid in emergency conditions. In an emergency, nurses may provide first aid to save the patient's life and prevent further disability. Example of first aid that can be done are pumping the heart in a cardiac arrest condition, providing breathing assistance, and so on. Does anyone have any question? If not available, this leads me to my conclusion. So I explained to you about 5 skills nurses must have, such as able to provide nursing care. The second is able to be an extension worker and counselor profession. The third is about carry out the task assigned. The fourth is about able to serve in limited circumstance, and the fifth is about provide first aid in emergency condition. The list of skills that nurses must have above show that being a nurse is not an easy task. These skills must also be accompanied by patient in order to carry out their normal duties well. That brings me to the end of my presentation. Therefore, let's give appreciation to nurse in Indonesia. That's all from me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.